I want to thank everybody on campus for being engaged, as also patient as we refine our format and technologies for these conversations. I think future meetings like this we will stream so that as many people as possible can watch. My appreciation to Sean Wood for being our technical producer today. I want to point out a couple of websites for the group listening today. These are coronavirus.utah.edu as well as returntocampus.utah.edu. These hold plans from a number of working committees from across campus. It's a lot of information out there. It's updated very frequently, so I encourage you to check it often. I also want to thank everyone who submitted questions. We received about 20 questions, really great questions. We'll try to get to as many of those as we can in today's 30-minute session, but we will also provide answers to those questions on the sites I mentioned before. Again, today's format will include brief remarks, and then we'll get to the Q&A in just a few minutes. So with that, I'll turn it over to President Watkins.
Thank you so much, Chris. We appreciate your organization, and thank you all for taking the time to join us today. I am so grateful to you for your creativity and innovation. You have done remarkable things over the past 3 months. Innovation in terms of keeping the University of Utah operations moving, even during this time of very abrupt change and a lot of uncertainty. We have wonderful people at the U who care about each other and are taking actions to protect the health and well-being of our community. I am grateful to you. I also want to take a minute to acknowledge really my empathy and how very sorry I am for the uncertainty and the anxiety that is caused by this uncertainty. We don't have a great roadmap for how to manage a pandemic at the University of Utah. And fortunately, we have wonderful people across this campus and in health sciences, infectious disease, and many other departments who are joining with us to help us solve problems in this very dynamic situation. So I think one of the most important messages of today is use the resources available, use the Return to Campus website, uh, access that kind of information, and stay tuned with us in this dynamic situation. If you think about 8 weeks ago, we knew a lot less about coronavirus and COVID-19 than we do today. And I know that 8 weeks from now, we're going to be that much wiser. And a lot of dynamic change is happening during this time. I think a question that's on everyone's mind is why return to campus? Wouldn't it be safer if we could continue the way we are? And I know that's a tempting question. I also have to say our business is important and our work matters. We believe that what happens on a face-to-face campus does add value, and there's some work that just simply cannot happen without engaging that way. And that's the primary reason. We know we believe in the value of education together and learning together and research and scholarship, and that work needs to happen. There is no end date to the pandemic, so waiting on the sidelines for it to end is hard too. And then I think finally, the very vitality and vibrancy of the institution is under question, and it's important that we engage to the extent we can. Now, of course, health, safety, and well-being are paramount. We are very interested in the public health guidance that we're receiving, and we're monitoring it all the time. I think that is a very important element of planning and risk management. I want to comment on a couple aspects that are still continuing to be in progress and underway as we think about managing risk for fall. Of course, testing and contact tracing are very important elements of safe opening of our campus. We are working with the guidance of Dr. Ed Clark on Dr. Mike Good's team, and also Stephen Lacey, who is our new chair of the Division of Public Health, and using their leadership and guidance to develop our campus testing plan. There are parts of the testing plan that we already know and our preparation well underway, and there are parts that we are still refining. The good news there is we are learning more every day about validity, reliability, sensitivity, and specificity in different kinds of testing. And that new knowledge is guiding us as we develop our campus plan. I think that it's an important element of risk management to be able to test symptomatic people, to do contact tracing, to test close contacts of symptomatic people, to get responses quickly, and to be able to have a safe space for people to be and stay during the time we're waiting to know if they have COVID-19. So that's an important element of risk management. But so is all the basic action that we can take to promote health. from face coverings to hygiene to physical distancing. And you will see lots of messaging and a training that's available to everyone to promote those many actions that we can all take. Now, there have been a lot of questions about who's making decisions on the campus and who's guiding and advising. There have been no fewer than 6 groups, including faculty, staff, a lot of leadership in the university and in the state, from the state system to the governor's office, helping as we develop plans for fall. Those groups have been very valuable for us, and the advice and questions of many have helped shape our actions. I think I want to give a particular shout out to those who may be with us today who've helped as we've developed our plans for fall and returning to campus. And I'm very grateful for the many people that have given their wisdom and time to this effort. I know you have lots of questions about things like when we will be able to lift a hiring freeze. I want to say that in the moment, as we wait to hear from our colleagues in the state about the base budget plan for fall, really beginning in July, the most prudent thing for us to do is to address the most urgent hiring needs. And you can imagine that there may be particular needs in the area of healthcare and healthcare professionals, and we are able to address those. But short of the most urgent matters, it is a wise thing for us to hold a little bit and survey that landscape carefully. So stay tuned for more information on when the hiring freeze can be lifted or modified or softened. But for the moment, it's a wise action that you're taking. And finally, I just would make one comment about the other issues in society, and certainly issues of racism, white privilege, and our own attention to how important racial justice is for our campus. We have work to do in this area, and we have every intention of doing it. There are actions that are already underway and many more that will happen across our campus. I look forward to that work with you, and it is very relevant, both in terms of health disparities and in terms of how we become a more fully equitable and just institution, which is so important to the success of our mission. So thank you, and I'm going to turn back to Chris for where we go next.
Dr. Good, you're next.
Great, thanks. Welcome, everyone. Kind of 3 points to help start our conversation today. One, I want to shout out to the University of Utah Health faculty and staff who have been continuing to work every day here on campus in the health center. Although our work has changed, and in some ways changed dramatically, we've been at work taking care of patients, and more recently resuming important bio and life science and population health research and so on. So many things have happened. Initially, we stopped elective surgeries. We tried to make sure we would be ready to handle however many patients with coronavirus came to the medical center. Because of all of the strategies we took together, we did slow the spread significantly. We did flatten the curve in Salt Lake City, in the state of Utah. And so in recent weeks, as you followed in the news, we switched everybody over to virtual telehealth visits, and now we're in the process. We learned a lot, and we will continue many of those telehealth visits, but those telehealth visits revealed need for things that can only occur in person. So now, with better understanding of our personal protective equipment, having our work protocols even more honed, wellness checks at all the entrances to the health center, we're about up to 85% of previous surgical volumes. As an example, our ambulatory visits are right about at pre-COVID levels, although 30% or more are still being done telehealth, 30 to 40%, 60 to 70 now back in person. And so we have universal masking throughout the health system. That's faculty, staff, visitors, guests, everyone. The learners are back in the clinical environments. And as I mentioned, research activities are resuming. So one, thank you to our team who has continued to work every day throughout this. We've also learned a lot. We've learned how to take care of our own, both on a physical basis. So we have people interacting with patients that have COVID every day. And actually, I got the numbers from our work wellness team. So through the course of the pandemic, we've had 2,000 healthcare workers who have presented for one reason or another for a coronavirus test, and around 100 are a positive. So about 100 out of 2,000 healthcare workers have coronavirus, and then they were treated appropriately, isolated, treated, and their contacts similarly identified, and make sure the isolation until they can get tested and so on. Essentially, all of these we can trace to either a household contact or a contact in the community. Very, very few are workplace, and most of those are from employee to employee, not from patient to employee. So that's one aspect of physical wellness. I really am proud of our resiliency center. Spent a lot of time making sure this is very stressful. This pandemic stresses everyone, and in ways we've not felt or experienced. And so our resiliency center, we're making sure is open, available with a variety. As you'll notice, most of our communications and transmissions end with a list of resources, and I'm pleased, people are using those resources to help them navigate individually. And finally, my third point, each week now I'll share a video update, a little bit longer version, but let me just give you a couple numbers. I tell people, remember 99 and 93. 99% of Utahns who become infected with coronavirus will recover. 99% will recover, and 93% will recover at home. So lots of variables, lots of statistics, but overall 99% recover, 93 at home. And again, if you want a more detailed way to follow the statistics in the evolving situation, we'll make sure the website and my weekly update is shared with you. Chris, back to you.
Hey, thank you, Dr. Good. Yeah, but both websites will have those links as well as at the U each week. Dr. Reed.
Thanks, Chris. I want to begin by echoing what both President Watkins and my colleague Mike Good said. A big thank you to all of you in the academic community for your flexibility as we sort through what's an extraordinary situation as we plan for the fall semester. I know certainty is what we all crave. I certainly do. But the most important thing we can do right now is be flexible and be prepared to adapt to changing circumstances. We surveyed our students and our faculty this spring to gain insights from the online transition. We're taking those ideas and implementing changes for the fall in terms of training and technology and other processes. We're continuing to develop specific guidance for laboratory instruction and design studios and other experiential education that are precisely the kinds of things that President Watkins highlighted as examples of why in-person education is so critical. It's a different kind of experience. But we're also mindful of the need to protect you, and that's the reason for work assignments and other processes and sanitization guides for classrooms, all of those things that go with that. We will be releasing later this week, probably tomorrow, a very detailed operational guide for fall instruction planning for each instructor, including language around syllabus for face covering guidance for students, for classroom processes around contact tracing and other kinds of things. And so I just want to say thank you to all for your flexibility, recognizing that the shift in semester to shift to online during the old fall break and then the shift to online after Thanksgiving is driven by protecting you, both faculty and staff and our students. And so I just want to end by saying thank you. I appreciate your flexibility. I know this is a cause for stress and do know that we're here to support you. And I'm sure Jeff Herring will say a few more words about resources available there. But I'm just so appreciative of the way the community has stepped forward and engaged these extraordinary circumstances. I've just been incredibly impressed by what you're doing. And I just want you to know how appreciative I am. So thank you, thank you, thank you. Chris?
Thank you. Thanks, Dr. Reed. Jeff, a few minutes from you, then we'll get to the questions.
Perfect. Not too much more to say other than I want to reiterate what Dr. Reed, Dr. Good, and Dr. Watkins have said about the thanks to all of you. I have the privilege of being able to lead what I think is the most valuable resource across the campus, which is our humans, all of you. And so as Chris mentioned, we really are trying to do our best in these dynamic times, these complex times, to try and put as many resources and tools and information out as possible. The Return to Campus website has got a current listing of where we're at today. You'll see many things there regarding face coverings, regarding temporary work adjustments, what that means, the process to go through, all the different things that we have. I think as Dr. Good mentioned, these are anxious times for many as we go through this. And I just want to reiterate that we do have our employee assistance program that's out there and available to all of our faculty and staff. During these times, we've also made that benefit available to all non-benefited staff as well. So please, there's no excuse not to be able to take care of yourselves as you go through any of these times. I think we've got a few questions that we'll probably get into deeper of the details and resources that we've got available. So I will wait for those and turn it back over to Chris.
Thanks, Jeff. So yeah, let's go right to the questions. We've got just under 15 minutes left here. So these are questions that were submitted before. We've taken the names off, and I'll just kind of work my way through them. Let's start with an easy one here, Jeff. This one's for you. I believe I've read that you will be providing face masks to staff. If so, when and how will they be distributed?
That is a great question. Yes, we were able to use some of the resources that we had in HR and order 40,000 face masks, face coverings for faculty and staff. As I'm sure you can imagine, that's a logistical challenge to get those distributed. So we've got multiple avenues of how that's taking place. Some of those individuals that have been on campus and have throughout this pandemic, we have distributed those. So UUHC, we just distributed those face masks up there. Health sciences, if you're in health sciences, those will actually be distributed to your leaders, which will then be distributed out to all of you. We've also done some areas, as you know, might have heard, that athletes have come back on campus. So we've actually distributed those to athletics. And our housing residential education staff that are starting to get ready for our students back on campus have had distributions. All the others, we made the decision this week, found the easiest way, I think, and the most streamlined way and the safest way is to use print and mailing services. And we actually have the masks in place. There's what they look like. I thought I'd bring an example of that today. Very, very nice. Those will be mailed out to all of our faculty and staff across campus. I think that makes it easier for everyone. We expect that will probably start the distribution next week. Print and mail services have to get some packaging for that, and then we will do some correlation of all those. And so I would expect in the next couple of weeks to get those out to you.
One clarification, Jeff, as well, is these are the masks being provided to faculty, staff, and students, for free. I think Print and Mail also has as an option to purchase more if necessary. So just as information comes out, just want to make that clarification.
That's right. And one thing on that, these are faculty and staff. We're working with Lori McDonald, Vice President of Student Affairs, on the face covering purchase for students yet. So, yeah.
And Jeff, since you had the floor, we had a question about the special incentive early retirement program that expired earlier this summer. The question is there a plan for another one of these this year or in 2021 that's similar?
That was really, as we started talking about the hiring freeze and other issues, that was really as we were starting to take a look at what is the fiscal consequences of that putting in place. There was a requirement on that special retirement plan to not fill the position for 1 year. That ended on June 15th is when that plan ended. I think as we get an assessment of the fiscal landscape going forward, we can take a look, but there are not any current plans for a different type of program for that as of right now. But again, that can always be dynamic as we look at the future of the budget and what we need to do as a university as well. But it was really designed as a cost savings measure for us.
Okay. Another question around for those individuals who are, and faculty staff who are immunocompromised or live with others who are at high risk and required to go back into the office, even if they might be able to work well from home. What would be your advice? I know there's a lot of information on the Return to Campus website with information, but maybe touch on that a little bit.
Yeah, if you look on that Return to Campus website, there was a flow chart for faculty, staff, and student employees about how to navigate this return to campus. And certainly there are things that are out there like the individuals that truly have a disability with something along those lines. And certainly we go through the ADA process, initiate that with HR, but probably the one that most people will be looking for and the tool that will be out there for most individuals will be what we're calling a temporary work adjustment. Certainly the CDC and others, we understand that there are people that are higher risk in this than others and have legitimate concerns. That's got to be balanced against the need to run a college campus with students and staff on campus as well. So those temporary work adjustments will look at the factors that the CDC has put out, as well as a category out there for others that are anxious or have other extenuating circumstances. The form is on the Return to Campus worksite. Those are at the discretion of the chairs or the deans in the units because they know that work best. But certainly we want to make as many accommodations or adjustments and work where we can to make sure that we do what we can for employees to make them feel comfortable and are safe on campus or away from campus.
And if I could just add to that, I wanted to highlight that as an example of something where we heard you. The initial version of the form did not include the ability for faculty and staff to specify other personal circumstances beyond the CDC and ADA. And hearing concerns from you, we modified the form to give you a mechanism to make your supervisor aware of other issues that might be relevant to your situation.
Dan or Jeff, we've had a lot of questions around kind of departmental specific return to campus plans, working from home. I know, Salt Lake City is still in orange phase. And so we're still, working remotely. Advice for those departments at a more local level about developing those plans in alignment with the return to campus plans.
I'll let Dan comment on that too, but let me just say that we've got a Project Orange team. That's is kind of the color codes. If we go to red to orange to yellow, as you mentioned, Salt Lake City still in orange, made up of a good cross section of campus. What I think is important for us to remember as we develop those plans is that we have the resources, the infrastructure to do that in a safe and smart way. So we don't want it all at once. We want to make sure we've got the facilities and the supply chain for the cleaning products and the PPE out there. So that would be my only statement on that is certainly we want to bring people to campus, but we want to do it in a way when the time is right. We've said that we won't move the campus until at least 7 days after the city goes to yellow, that we would start looking at that. But we want to do it in a way that we make sure it's safe and supported by the infrastructure for the campus.
Yeah, and I just echo that safety is driving all of this. We will certainly, we will be circulating a checklist that sort of walks through these are the things you need to do before reopening an office, contact these groups, make sure these things have been done. And that's true for all of the services. Certainly as we think about the return of our students to campus in the fall, we will want to make sure that we have the critical offices staffed in a safe way so that students can see people and engage them. And that's part of the return to campus instructional guidance that will be shared as well.
Yeah, and I do want to thank people who submitted questions. A lot of people have done some research and provided some other schools who provided departmental templates. So we are listening, we're incorporating that to our planning as well. Jeff, just a basic question from a couple of people. So the scenario is I get sick, I'm in the hospital for 2 months with COVID. What happens to my pay and benefits? How might that be different than, that occurring from some other reason?
There is that's going to be different for everyone, Chris, on that. But what I want everyone to know on the general purposes is that we do have a health insurance that will cover, that it's got great benefits. It will cover the testing with 100% and any type of treatment at the normal rates. But it's a great plan that we've got for faculty and staff. That being said, what I have discussed with the cabinet and others is for anyone that we send to get tested, that is, we want to make sure it's safe, and we send people to get tested when there's symptoms. The attestation that you'll have when you return to campus, really, we want everyone to make sure that they are doing their part in making sure they're not coming. And if they do have symptoms, we do want them to get tested. So that we don't have the pressure of individuals wanting to come to work, because it's real economic pressure for being off at work as well. We will be providing paid admin leave for people that are in the pendency of getting the test done or have a subsequent positive test and have to go quarantine. Now, certainly there's different levels. I think Dr. Good would agree of being able to do some work while you are in that quarantine. We'd certainly want to do as much as we could do, but if the situation were not to be great in the diagnosis of that, we have paid admin leave for that to supplement that until we can return to work as well.
Excellent. We're getting close to the bottom of the hour. Jeff, this information's on the page, but maybe just asking for a clear statement about face covering policy on the University of Utah.
Yeah, face covering. This is one, I think, as we talk with public health, and I think it's supported out there, is we've got to learn to live with this, especially on campus and in other areas of society. And we want to do that in the safest way possible. We are in this all together, and all together we'll get through this. We are providing the face coverings for all faculty and staff. The clearest statement I can make is that face coverings will be required when you're not able to physically distance and when you're inside of any building. It's the safest way, I think, for us to protect all of us together as we go through, and that is our paramount North Star focus is making sure people are safe. So it is going to be a requirement on campus for face coverings, and I think that's as clear as I can say. What can I say? One other thing about resources on this as well, Chris.
Yes.
There will be a lot of questions. There's going to be a lot of answers on the return to campus. We do have our employee service center. The number for that, you can find that, but the number is 1-801-581-7447. Know that they are providing answers for all of campus. So they will take those calls, build a case, and get back to you as soon as possible. But they are, as you can imagine, we have reallocated resources across that. But that is going to be the best stop for personal information for any aspect of these questions that you could have going forward. We have meetings all the time and are going through that with our HR team very carefully to try and develop answers to all the questions you might have.
Excellent. Thanks, Jeff. We're about out of time. I would like to turn it back over to President Watkins. I just want to remind our audience we are going to do this again. We're going to continue to do this. Dr. Good is going to continue to update campus, and we will continue to update our sites, our At the U page, and just continue to try to get as much good information out there, knowing this information changes. So with that, President Watkins, I will give you the last word. Oh, but we'll unmute you first.
Thank you. It's not fair to give me the last word when I'm muted. Something wrong with that. Hey, thank you, everyone. I appreciate that so many people would join us today. I want to give really special thanks to my colleagues, Mike Good, Dan Reed, and Jeff Herring, remarkable people helping lead this campus forward. And I would just say, if you want to be reassured watching and hearing from a health expert, watch Dr. Good's video. It does help to look at the metrics that matter and to know that we are all paying careful attention to those. So stay well and join us for the next webinar. Thanks very much.